Hello everybody. Today I'd like to discuss PICC line care. As long-term care nurses, we often have little exposure to some of the orders and techniques we need to know. Some are common, some are not. PICC lines are somewhat common in our facility. Not so much as a hospital, but we do see quite a few of them. And this is the purpose of the presentation, to review some of those techniques and why we do them. First, we're flushing the catheter, and the purpose is threefold. We're assessing the catheter function. This is why we're aspirating for blood. We want to maintain the catheter patency and prevent contact between incompatible medications of fluids that could produce precipitate, which could certainly cause a problem. Technique. First, we're using Scrub the Hub, which we're cleaning the connector with an alcohol wipe for 15 seconds. And allowing to air dry for 10, and you want to remove your air bubble from your syringe before you connect it. Then we're aspirating for blood, return to ensure the line is patent, and then we clear the line with this flush. And the flush technique is a gentle start-stop motion to create agitation in the line. Push pause. Too much pressure can damage the end of the PICC line, and then after that we're doing SASH. Scrub the hub. The catheter hub is a known source of catheter line associated bloodstream infections, Clasabes, and to prevent Clasabes, we are scrubbing the hub for 15 seconds. PIT recommends at least 30 twists of an alcohol wipe, and that ensures we get our 15-second wipe and allow 10 seconds to dry. And you do want to use a new alcohol wipe each time you have to do this, just to ensure you're using enough alcohol. SASH requires scrubbing the hub 4 times. And why are we doing it for 15 seconds? Because we want to get rid of the bacteria and anything that can cause an infection. As you can see, no prep gets quite a bit of stuff left on there, and 5 seconds it's still there, 10 seconds it's still there. 15, we've cleared most everything off the hub. SASH is by definition first a saline flush, and we're ensuring the patency of the line, clearing the residual medication. We're administering our medication, then we're doing another flush again to clear the line of residuals, and then finally we're doing a heparin flush, and this is done to prevent blood clot forming inside the catheter lumen. Why this is important. Clasabes. 1 in 20 patients in the U.S. acquires a hospital-acquired infection. Clasabes is certainly one of the most dangerous ones, and the CDC estimates costs $16,550 per Clasabe, with a mortality rate of 12 to 25%. 1 in 5 people will possibly die from this. In U.S. hospitals, 41,000 occur annually. Reduction of Clasabe is a 2014 National Patient Safety Goal, and when it comes down to it, we are trying to deliver excellent patient care, and performing these techniques properly ensures that we are delivering that care. Next, I'm going to demonstrate the 2 techniques we've been talking about, Scrub the Hub and SASH. To do Scrub the Hub, we're going to take an alcohol wipe. You want to twist about 30 times. And that's according to PIT, and that approximates 15 seconds of scrub time. You want to scrub vigorously. And then you want to wait about 10 seconds. And that's the dry time, also according to PIT. And that is Scrub the Hub. Thank you. After you've scrubbed the hub, you want to take your flush. We're going to aspirate for blood. The reasons we're doing that is to maintain patency, ensure patency of the line. And you disconnect. You want to do a push pause. The reason you do that, you create agitation in the line, and then you go gently so you're not damaging the end of the PICC line. Put a little bit in, and you pull back until you get some blood return. And we have a small amount of blood return, but that's good. Flush the rest in. Push pause. And that's it. If you have trouble getting a blood return, you can always have the patient lift their arm up and change positions that way. You want to turn their head away. Sometimes that will help. And also you can change it from a sitting to a prone position and vice versa. If you cannot get blood return, you're going to have to call PIT and let them come bring some cath flow and open that line back up. Whether you're going to administer the medicine or not is dependent on how the line plugged. Was it gradual? Was it sudden? How hard is it to flush? If you're in doubt, I would call PIT and go from there. Thanks. I've done scrub the hub and aspirated for blood. Now we'll start SASH. And you do have to scrub each time. Do your 30 twists. And pausing 10 seconds to let the alcohol dry. Sure you don't have an air bubble. Now you're just doing a straight out flush. This also is push pause gently. Your next step, you're going to scrub again with a new alcohol wipe. Same 30 twists. You do have to do this 4 times. 10-second dry time. You're going to hook up and administer your med. Then when your med is done, you're going to disconnect. Get another alcohol wipe. The reason you get another alcohol wipe is to be sure you have enough alcohol, so you're not using it all up on one scrub. 30 twists. Ten-second dry time. Sure your air's out. Push pause. Then, you get another alcohol wipe. .30 twists. This gets your 15 seconds. The last thing you want to do is run heparin. And that maintains the patency of the line. And that is SASH. Thank you.